Hello, Dr. Smith.
Yes.
Hi, welcome. Dr. Mazzio, please have a seat.
Thank you.
Hi, I'm Dr. Feldhaus. Can you tell me your full name?
Yes, Julie Smith.
So nice to meet you.
Nice
Have
to meet
a
you.
seat. Dr. Mazzio and myself will be your examiners for this. This is a clinical decision-making case. And so remember that there's no role-playing. You should simply respond to the questions I ask. At times, you may be asked general questions regarding your clinical decision-making. Additionally, at times, I may interrupt you to move you through the case, and this is not a reflection of your performance. You have 15 minutes to complete the case. Do you have any questions?
No, I don't think so.
All right, our time begins now. The patient we will be discussing is a 14-year-old female who presents to the emergency department following a syncopal event. Her initial information is here on the screen. And after you have reviewed that information, what specifically would you ask of the patient, her family, or bystanders?
Well, first, I'd like to just introduce myself. So, hi, patient. My name is Dr. Smith. I'm here to take care of you today. What brings you in?
Doctor, if I can remind you, this is not a role-playing case. You should simply respond to the questions I ask.
Okay.
So again, specifically, what would you want to find out from the history of this patient, from the patient, her family, or other bystanders?
Oh, okay. So she's coming in with fainting. Her vitals look good. So I'd like to start by just asking what happened regarding the event. What was she doing at the time? Did she have any symptoms leading up to the event? Did she have breakfast or a meal earlier today? What does she recall right at the time when she woke back up? Was she confused, or did she seem like she was alert? And then, does anything hurt right now? Did she injure herself in any way? I'd like to know if there were any bystanders, if they saw what happened. Particularly, was there any head trauma or seizure activity? And if she knows her own history, has this ever happened before? And probably just her general past medical history.
Thank you, doctor. Now, would you please discuss what specifically you would be assessing on a physical exam of this patient?
All right, so for her, I have the vital signs, and I think I'd like to start with just a general assessment from the doorway. So does this patient look in distress, or does she look comfortable and well? And then I would probably just start with a head-to-toe exam. So I'd start by palpating her scalp and her neck for trauma. And then I would do an HEENT exam. I would like to listen to her heart. I would like to auscultate her lungs, palpate her belly. I would like to do a full neurological exam. And then I would also like to palpate her extremities and just check for any injuries.
Doctor, can you clarify your cardiac exam?
Yes, for that I'm listening for any murmurs or abnormal sounds.
Thank you. And can you clarify your HEENT exam?
For the HEENT, I would like to palpate the scalp and check her pupils, and then I would look in her mouth.
Thank you, doctor. Here's the additional historical and physical exam findings, and it's also displayed for you on the screen. The patient was participating in a competitive track and field event, and she fainted and collapsed when she was running her 400-meter race. There was no head trauma. She denies any prodromal symptoms, specifically no chest pain and no shortness of breath prior to her syncope. She's never fainted before. She takes no medications, and she has no significant past medical history. On exam, she has no complaints. She's neurologically intact. Her cardiac exam is normal without a murmur, and there is no evidence of a seizure activity on her examination that you found. Additionally, the mother was watching from the stands, and she reports no seizure activity. It just looked like the patient collapsed. She did not strike her head.
Okay.
At this point, based on what you now know, what are the top items in your differential diagnosis?
Can I just have a minute to put all this together?
Absolutely.
Okay. running. There was no seizure activity. So it sounds like seizure probably didn't happen. I guess I would leave it on my list, but I would be thinking about electrolyte problems or dehydration. I'd also think about just a vasovagal type episode. She was running track and field. Oh, and I would also think about maybe some cardiac causes.
Thank you, doctor. Based on what you know and your working differential, what, if any, diagnostic studies would you order or perform at this time?
I would want repeat vital signs. I would want her on the monitor with then a 12-lead EKG. Let's see, for tests, we should get a finger stick, glucose, and she's 14. We should probably get a urine pregnancy test, and then a CBC and a basic metabolic profile. Thank you.
Doctor, I have a question for you. It's not specific to this particular patient. For cases of syncope in general, when would you decide to order a head CT?
I think for a head CT, I would rely on some established clinical decision-making rules, and I think I'm going to look for red flags on the history or physical exam.
Thank you. Can you clarify what you mean by red flags?
Oh, sure. So I think about maybe in the history a sudden onset of headache associated with this, or on her exam, does she have any focal neurological findings? Is this an elderly person and they're on blood thinners? That would make me concerned. I think, those are like the main things.
Okay, thank you, doctor. An electrocardiogram has been performed on your patient. Please interpret this EKG.
I see a regular rhythm and rate. It looks sinus at probably 75. And I don't really see any ischemic changes. The intervals, that looks okay, but I think it looks like there's a pretty prolonged QT. Yeah, I think that's prolonged QT.
Okay, doctor, I have a follow-up question for you that, again, is not specific to your patient today. For cases of syncope in general, what are the high-risk findings that you're looking for when reviewing an EKG?
High-risk EKG. Okay, so obviously I'm looking at the rate. Is it too slow or too fast? And then what's the underlying rhythm? Is it normal sinus rhythm or something else? Then I would be looking for ischemic changes. And then finally, I look at the intervals and make sure that there's no heart block or obviously prolonged QT.
Okay, thank you.
Thank you, doctor. Regarding your patient, here are the results of the other diagnostic studies which you have performed. Patient's pregnancy test is negative. Her CBC and her comprehensive metabolic panel are as displayed and they are normal. The glucose is normal. And a bedside cardiac ultrasound was performed and is normal. At this point, what treatments or actions would you take in the emergency department for your patient?
Given her normal CMP, she's not pregnant, her POCUS was okay, but I have this EKG. I think I need to get a pediatric cardiology consult and probably a comprehensive echocardiogram.
Thank you, doctor. The patient has been stable in the emergency department with no arrhythmias or complaints. At this time, what would you discuss with the patient and her family regarding your evaluation?
I'd want to tell them that her labs are normal and that I'm most concerned about her EKG, that I think it has something abnormal called a prolonged QT, and that may have caused her to pass out, and I would like to get pediatric cardiology to see her.
Okay. Cardiology has been consulted, and they recommend discharge with follow-up in their clinic tomorrow. The patient and her family are in agreement. What instructions would you provide and what precautions would you discuss at discharge?
So for instructions, I guess, so she should probably be with an adult all night. She's coming back tomorrow, so that time frame is pretty short. Oh, she should definitely not exert herself, so no sports, and not start any medications for the next 24 hours until she sees cardiology. And precautions, she should just come back if this happens again.
Thank you, doctor. This will conclude your case.
Oh, okay. Thank you.
Mm-hmm. And when you exit, just turn to the right and go back to your assigned seat.
Okay, thank you.
Patients.